22 to 31. Paul started his own agency 23 years ago after spending 9 years working for major insurance companies. Paul specializes in individual, family, and business health insurance with a special focus on people that have Medicare. Take it away, Paul.
We also raised a 3-year-old at our house, and when he saw this sign at our house, he picked it up and did this. Because he sees those sign shakers, so I was thinking about
That's
it.
so funny.
So this was a nice little sign that Gary did for me. Kind of portrays what I do. I think one of the most important things about running a business is answer your phone. So when John called me the other day, last night actually, I answered the phone. He was surprised there was going to be an answering machine. So we do get a lot of business. My wife and I each have our own business, and we answer the phone, and we return calls. So that's huge, and it's something that really helps us stay in business. I like what I do, and I think it helps to like what you do, be enthusiastic, and every time I meet somebody, I try to find something to like about it. And I think, for me, it's a game, and it makes it fun. So no matter whether I'm talking to a senior or a business owner, it's just a game. I'm going to have fun. So it's whether I see a picture on the wall, or I see something about the dog in the office. To me, it's always a fun experience. And I think it makes the meeting go well, because they see I'm at ease and having fun. A good tip for me are people that basically need health insurance. And right now, because we're open enrollment, it's a big time to talk about health insurance. And we're doing the senior open enrollment now, and this company happens to be very competitive. So a lot of times when I'm talking to people, I'm saving them a lot of money. In fact, every day, 3 or 4 people a day. Yesterday I spent 2 hours with a couple and ended up making 3 sales. Because they also had a daughter that was mentally retarded and has been in the system, Medi-Cal, Medicare. We have a special program for that. So HealthNet has a great program for people that have Medicare and Medi-Cal. I have programs, there's 10 plans in Sacramento. I represent 8 of them. Kaiser's the one I don't represent for Medicare. But for individuals, we're coming up on Cover California open enrollment. And that starts November 15th, and that will go through February 15th. So we're doing the renewal process right now for Covered California. So it's just a lot of activity. If you don't know somebody that needs health insurance, you're not awake, because everybody needs health insurance. If you're covered by your employer, then you're probably good, unless the employer's unhappy, and I can help the employer with group health insurance as well. Last week I got to fly down to Southern California. I happened to be a pilot, and it was a real thrill to fly down to Southern California, fly over the Grapevine at 12,500 feet, fly down there about 135 miles an hour, and fly back about 145 miles an hour as I had a tailwind. So I can do that in about 3 hours. It's not a fast airplane, but it's a lot faster than driving, and the scenery's a lot better. So that's a real thrill. Next week I get to go to Monterey to see some people that are turning 65, and yeah, it's an excuse to go down there, and it's really an excuse to fly. So to me, if it covers my gas, then I'm good. Backups. In business, or when you're flying an airplane, you always want to have a backup plan. So when I go out and see people, I carry extra supplies. I actually carry a printer with me, because I never know what I'm going to need. The goal is to get the job done at the meeting as efficiently as I can. But when I was flying down there, my iPad battery went dead, but I had a backup because I have iPhone. And then on the way back, the airport lighting wouldn't come on, so I couldn't land at the airport. There was an airport next door. I landed there. And of course the wife was home, so I was able to get a ride. So backups are always important. Does anybody have any questions about what I do or how I can help?
What kind of plane do you have?
I have a little Cessna 172, 1977 with a rebuild engine, 120 20 hours on it. Airplanes go about 2,000 hours before you got to spend about $25,000 to rebuild the engine. And they're very reliable. That's why they cost so much to rebuild, because they're so precision tool. But it's when everything's running right, it's a lot of fun.
No kidding, huh?
We were curious back here about the fuel. What type of fuel is used in that airplane and how expensive it is?
It's low lead, av fuel, high octane. They sell it at the airports.
What mileage do you get?
I get about 15 miles per gallon, going down at about 18 miles coming back. If you have more wind fighting you, you're going to get less, and if you have more wind pushing you, you're going to get more.
So 2,000 hours, about how many years is that?
That's about equivalent to 100,000 miles in a car. People will push it, but when you push an engine like you push a car, you're going to find that things start to break. You don't want them to break when you're flying. One minute left. Go ahead.
You said you weren't, when it came to Medicare, you weren't certified in Kaiser? I feel like a lot of seniors like Kaiser. Why would they prefer Kaiser over the other ones?
People grow up with Kaiser, and so they're familiar with it. And
It's not really any
it's
different?
a comfort level. I'm not going to say anything bad about Kaiser, because it wouldn't do me
Yeah.
good, because they do a lot of good things. But just give you an example, Kaiser has 3 ophthalmologists on the staff. UC Davis has 30. So
Yeah.
if you have a problem with your eyes,
Their eye
what
program's
plan do you
nice.
want to be with? And I'm just trying to give you a hard time.
I know people with that.
Because he has Kaiser, but
I have Kaiser too. I do. So,
Kaiser's good.
yeah. Okay.
That way you can't see your bill.